Hello everyone, I am Dr. D.K. Umashankar. I am a consultant in advanced laparoscopic, bariatric and general surgeon. So today I will be going in thoroughly about the complication of the gallbladder stones. So you should know the anatomy. Below the liver there is a tube which is called as common bile duct. With the tube there is attachment which is called as gallbladder. And then due to some reasons which I have explained in my previous video, stones is formed. When we don't get the treatment on time, when we delay the treatment, what happens is these stones from the gallbladder, they slip down into the CBD, we call as a common bile duct. Once they slip down in the CBD, the tube gets blocked, and the juices from the liver, which is called as bile, has to go down from the tube into the intestines for the digestion. It won't go. So what happens when the stone is stuck in the tube? All the bile will be inside the tube and the liver. Then what happens? Patient will get jaundice. All the bile stays in the liver and goes into the blood. That's why people will have jaundice, yellowish coloration of the skin, all mouth, hands, all those things. Then what happens? The tube, which is called as CBD, gets infected. We call as a cholangitis. Patient will have fever, severe pain in right upper abdomen, he have vomiting, and they have to come to the hospital. So what happens when now earlier there was a stone in gallbladder, now the stone has come into CBD. So what happens now? Patient has to undergo one more procedure which is called as ERCP. ERCP is endoscopic retrograde cholangiopancreatography, where we put a tube from the mouth like an endoscopic procedure. First we need to take out the stone which is stuck in the gallbladder CBD, and then next surgery is for removal of the gallbladder. So unnecessarily they will be patient will be undergoing two surgeries rather than one surgery as previously once patient diagnosed. Now second complication, what happens is when the stone gets blocked in the cystic duct, not in the common bile duct, in the cystic duct, then what happens? The juice will not go down, and then what happens? This juice get infected and become pus. So it is called as the mucocele of it is called as a empyema gallbladder. And then what happens? The gallbladder becomes infected and patient will have severe pain, vomiting, fever. It's an emergency. They come to hospital. An extra day of stay is required for the patient to recover. We put an extra tube in the abdomen to remove all the liquid. Now one other complication is we call as a mucocele of the gallbladder. Same like the stone gets stuck in the cystic duct, and then there is an infection, and then all the bile converts into mucus. So you can see the photograph I am posting, all the mucus will be there. Same thing, patient complains with pain, abdomen, vomiting, fever. Okay, so these are complications. Next complication is there will be a fistula formation. If suppose patient is not getting treatment, even though they know that there is a stones and there is a mucocele, what happens? The layer of the gallbladder start getting infected, and then it get perforated. Perforated means it opens up because it gets weak. It opens up and then it gets connected to intestines or liver. If it connects to the liver, then what happens? Liver abscess will form. So liver will get all the pus filled up. Now the surgery required is first to remove the liver abscess and then go for the gallbladder removal surgery. Again, this is a hectic surgery, and then again patient has to stay for in hospital patient for few more days. Same thing if that perforation get connection with the intestines, it's called as a fistula formation. Again this need a major surgery, and again the healing, the post-op recovery will take more time. So these are the common complication what we see nowadays in the people who avoid surgery, who avoid going for a surgery when initially told to go for a surgery. So what the one most important thing we should always remember is whenever there is a gallstone, there are 1 to 5% chances that patient can have a cancer. So the surgery as early as possible. If we get the surgery done, we send the gallbladder for testing. In 7 days, we get to know whether it's a cancer or not. Many patients have been found out that it's a cancer. So the early we diagnose the cancer, the better life expectancy of the patient. Okay, so whenever you feel you have diagnosed with a gallbladder stones or acute calculus or acalculus, without stone or with stone gallbladder infection, you have to go for a surgery. There is no other option. Don't rely on medications. I hope these all complications of the gallbladder stones, if untreated, think you might have understood. So I hope in the coming time you should be more aware and get the treatment as early as possible. Thank you for watching. Thank you.